Hi, everyone. Thank you so much for joining this Ask Me Anything session. I see there's a lot of you. So a little quick intro. My name is Rubina. I'm an academic recruiter with Aspen Dental Management. We're the support organization for Aspen Dental, and we're here to support all of our doctors nationwide. So before we begin, I just wanted to let you know that there's a question and answer box on the bottom. So feel free to type in any questions you might have for or Mike, and I will go ahead and moderate them, and they'll answer all your questions. So you'll often see me looking down or looking to the side. I have a second screen right here, so that's where I'll be navigating all the questions. So there's not really anyone else in the room. It's just how I do this. So if you do have any further questions that you just want to ask privately, you guys should have my email address. So feel free to email them, and I can forward them to either Mike or Dr. Gerard to answer. But that's all I have. So without further ado, I'll have Dr. Gerard introduce himself and give a little bit of background information, and then we'll have Mike also provide an introduction.
Okay, so good evening, everyone. You all can hear me, right?
Yes.
So my name is Dr. Ali Jarrar. I work in Saginaw, Michigan. Graduated from West Virginia University 2016. So it's been 4 years. I worked in Illinois for 3 years, and now it's been 6 months in Michigan. Looking to grow, get bigger with Aspen, and join more offices as we go, hopefully. So here we are. I'm here for you guys to get your questions, so don't feel hesitated or anything. Let me know about any questions that you think about.
Perfect. Thank you. Mike.
All right. Hi, everybody. My name is Mike Morgan. I am the Regional Development Manager in Central Michigan. Central Michigan has varied from everywhere in pretty much most of the state at this point. I've had a chance to work with almost every owner. So hopefully I'll be able to answer any questions you have from an operational or support standpoint. Anything clinical, I'll make sure we push back over to Doc, because that's what we do. So looking forward to being able to answer any questions, debunk any myths you might have, and even answer the tough questions that you don't want to ask anybody else. But that's what we're here for. I've heard them all, so you're not gonna get me with the one we haven't. So looking forward to the one we haven't. That's what I'm always looking for. So, but yeah,
wonderful.
Excited to be here.
Thank you both for joining. So just right off the bat, for Dr. Gerard, what options did you look into coming, out of dental school, and why did you end up choosing Aspen Dental?
So graduated, started looking for a job. Some of you might have a family member that might hook you up with their offices. Some of you might have a connection somehow. I didn't have any of that. I graduated, I started just searching for a job with corporates and private practices. Pretty much I had all my options open until I got the best offer from Aspen. And we were supposed to go have an interview in Iowa. They had a location there to where they can set me up as a managing clinical director, and having some loan repayment options and stuff like this. So it was the best offer for me that fits the position that I want in my work atmosphere. Also that supports me financially toward also repaying my loans, my huge loans. And also I liked it because they offered the managing and administrative backup support, which is Mike will be covering that part. But it's a huge difference between that atmosphere and having on your own, either opening your own practice or joining a family member or a smaller office, let's say. So definitely the decision was kind of easy for me. Made it and started. I ended up starting actually in Illinois instead because it's closer to where I live in Chicago. They have, that's the other thing that I liked Aspen is that they have a lot of offices and locations. So pretty much nationwide, they're all everywhere, you know, wherever you go, there's always a chance. So the room for improvement and growing is a lot bigger than you know, any smaller offices or private practices. So and that was my goal since the beginning. So I chose Aspen that kind of, you know, fits all the pieces in the puzzle together. Yeah.
Yeah. So I just got a question. I think first Mike can answer this, and then I think Dr. Jar, you can go afterwards, just based on your experience when you were applying. But what does Aspen look for in an applicant when determining, you know, if they get hired or not? Does class rank help, resume, letters of recommendation, or is it just based off the interview? And I know, Mike, you interviewed plenty of doctors, so.
Yeah. Yeah, we do. We interview doctors all the time, and I'd love to say it's just a rank and grade, but at the end of the day, we're hopeful that your schools have all done a good job of getting you all trained clinically. For me, I'll be honest, when I look at doctors that are coming out, rank is great. Your abilities are great. We want to know your passions though, and it really comes down to the person. I will tell you, there are Aspen doctors. There are non-Aspen doctors. And I tell people that in the interviews, and we have conversations around it. My doctors that I get to work with, they work hard, but they're passionate about what they're doing. They're bringing care to a group of people who wouldn't have it usually in any other case. We're opening up access to care to divisions of the population that have been almost set aside for a long time. We're working with them, finding plans that work, with doctors that are flexible in the treatment plans, because not every patient can go forward with the whole treatment plan at once. So it's really about the comfort. But when I'm looking at a new grad, I'm also looking for, what do they want? To Dr. Ali's point, or Dr. Gerard, sorry, official call. It's about, what is your long-term plan? Do you want to do fillings the rest of your life, or do you want to grow up and own your own practice? And either one, there's a path at Aspen for you. However, reality of it is, we're here to help doctors fulfill their dreams. My owner has 6 practices, and she started with just one. And really not even knowing if she could do that, but with the support we gave her, and she grew it. So it's a multifold that we look for in the doctor. Abilities are great. I know one thing my doctor likes to look for is either a residency or some time doing trips out of country and doing just some mission trip type work. She likes to see that. We do deal with a lot of extractions and surgeries. So I'd say about 40% of our patients are denture patients with extractions. So if you've got comfort with that coming in, that's always a good thing for the owners to hear and the doctors to hear. But again, the other part is what you want to grow into. So if you're looking for mentorship, our doctors that we partner you with, that's what they're there for. Dr. Gerard is just that. He's a mentor doc. If we have an associate, we put them with these mentor docs, and they help them build their skills and build their abilities, not just as a doctor, but as a leader in the practice too. So it's really a long-winded answer to say we look for a lot of things. But as much as class rank is something we look at your abilities, we look at where you graduated from. I'm also looking at your personality. Are you going to be a good fit for a hardworking office? Because end of the day, it's work hard, play hard, get paid hard kind of thing. You're definitely rewarded for the work you do, but you're definitely also working, and that's what we want to make sure.
Wonderful. Dr. Gerard, do you have anything to add to that?
Since I really haven't interviewed doctors for Aspen so far, but I kind of agree with pretty much what Mike said. Not every doctor is an Aspen doctor. Not every, Aspen location is good for everybody, but just look at it this way, that it's a growing company, and a lot of opportunities for everybody. And we look for people. If I'm gonna interview someone, I'll look for someone who's hungry for work. You get the practice going, you get yourself going. You benefit, we benefit, everyone benefits out of it. The patients benefit too, because you're getting patients in and out fast with uh, good quality care as well. So pretty much looking for um, people who are willing, to always improve.
Wonderful. Um, Mike, could you go a little bit more in depth on how you were talking about your owner doctor and how exactly like you're, with a region, with a certain owner doctor, and how there's different ones and the difference between owner doctor, MCD,
Yeah.
associate?
You mean all of our lovely alphabet soup?
Yeah,
acronyms?
exactly.
Okay. So yeah, we call our owners POPs. It's a practice, a partnership owner program is what it is with our doctors. End of the day, I always want to make sure people are 100% clear. Doctors own our practice. ADMI, or Aspen Dental Management, who Ruby and I work for, they do not own the practices. Doctors own all the practices. They are treated no different than a private practice locally, with the exception of they have brought in Aspen Dental Management to help them consult for them. So that's where the partnership comes from. And these doctors can own one, two, up to, I think there are some in the 20s in some areas. So it really just depends on the growth potential in that area, as well as the availability of offices. Sometimes owners sell them to other people, but other doctors as well, as they grow with them, or as they just look to maybe change their direction as an owner. And so that's what we call a POP, or an owner doctor. Below that, we have a partner doctor, who's somebody who has partial ownership, which we'll be getting some doctors there pretty soon, right, Doc?
Yeah.
And this is where a doctor has bought into a portion of the practice, and shares, much like the owner, the larger margins of the practice. Then we have an MCD, or a managing clinical director. Now, every practice has an MCD, whether it be the owner or an MCD. Dr. Gerard is an MCD in our Saginaw practice. That is a managing clinical director, and they are responsible for everything clinical within the four walls. They're in charge of helping to train the dental assistants, helping to coach the hygienists, keep everything clinically aligned, work with the owner on any additional training or development that's needed. And then partner with the administrative team up front, as well as the field team, myself, to make sure that the office has what they need. The only other level is like an associate doctor, and that's typically where new grads start. That's the expectation, is they would start as an associate, and then work your way up to the MCD level. But that's under the tutelage of that MCD, and really understanding the not only the model, but how to interact with the patient, how to maximize your time in the practice, managing multiple chairs, because effectively you're seeing 5 to 7 new patients a day on average. You're seeing a production chair and an overflow chair, and as an MCD, that's not a hard task. But I will say, as an associate fresh out of school, seeing 37 patients in the course of 8 hours might be a bit much. So we tend to work you into that program through the associate mentorship. And a lot of times, like for my owner, we have 6 offices. So we've got, even in the Tri-City area, so we've got Midland, Bay City, Saginaw, we've got the ability to bring on an associate there where they work 2 days with one MCD, 2 days with another, not only get different team dynamics, but they get different viewpoints and different, skill sets as well, from multiple doctors. So it allows them to grow quicker. We've got doctors that have grown. I've got an associate right now who's been with us 7 months, and he's now ready to take on the role of an MCD. So it's great to see the growth that quickly. He's been very passionate about learning the business. But that's kind of that step that it takes. You learn the business and you learn to run it like it's your own. And then you move from associate to MCD. I've got other associates who've moved from associate to owner in less than 4 years, but it involved willingness to go to areas that were just opening up. So it just
Right.
depends on what you're looking for.
Awesome, thank you. Now, Dr. Gerard, Mike mentioned, as associates, you're seeing a certain amount of patients, and then as an MCD, you see more. As you started, as a new grad starting at Aspen, did you feel like you had enough support? Was it hard getting used to seeing so many patients? Did you see a lot of patients? How was it just stepping in from graduating from West Virginia to working?
Yeah, and this is probably what everyone is thinking about, it's a big step. You're moving from doing 2 patients a day at dental school to 37, like Mike said, or something around that. It's not easy at the beginning, but that's why it actually depends on what you guys are looking for. You're all now doctors. Each one of you has their own mentality and preferences. So for me, I graduated. I had in mind I want to work in Chicago because that's where I lived before dental school. But all the positions were associate positions in Chicago. Nothing wrong with that. But I always saw myself as an MCD coming out of the school, right out of school. But I like to take that challenge. I like to be challenged like that. So I had to move, like Mike said, a little bit further away from the big town down to Springfield, Illinois. So I had an MCD role starting in my career, and I had my owner, uh, the doctor who owns the office. He was coming, let's say, once a week at the beginning as a mentor. So you can say that I had a mentor maybe my first 6 months. Actually, it helps a lot because, yeah, I like to take the challenge, but it was a big challenge, and he helped a lot. He pretty much gave me the room to take a lot of decisions. Some of you might be scared of, doing a molar endo, for example. And the truth is, if it's going to take you 3.5 hours to do it, refer it out. If you're good at it, do it. He gave me that freedom. I mean, I kind of ran the schedule as I like, and I enjoyed it. And after, I would say probably 6 months, he started cutting down his visits to my office, and I just noticed that it's actually doing good, improving, even with his less time coming in. So um, if I go back in time, I'll probably take the same decision. It's just the way that's me. But if some of you are a little not ready for that big, push, or or finds it frustrating, you can start as an associate. Like we have a lot of doctors start like that, and it's a very good also experience because you'll have an MCD next to you every day. So you don't have to worry about the little details, the um, um, administrative thing. You just focus on doing clinically, and we're not going to teach you clinical work because that's the dental school work, but pretty much it's just to get a little bit on the fast pace in order to improve and see um, more patients, and hopefully then you'll be jumping from associate to MCD to um, partner or owner, or multiple offices. So
Wonderful, thank you. As you came out of school, someone asked, does a newer graduate get paired with a more experienced dental assistant? Could you elaborate just how your situation is with your dental assistant? Did you get to pick one? Did Mike dictate who you had? How exactly does that, dynamic work with all of you? If, Dr. Jar, if you could answer first.
yeah, so the way Aspen does hiring, let's say you get hired, they put you for between 4 to 8 weeks of training in a in an office. So basically, you're just there shadowing, you're watching, you're learning as much as you can, and after that, you start your career in your office. So I've trained in one office. I worked in two different offices in Illinois and then in Michigan. I pretty much had experienced assistants in all the offices. So we usually try, of course, to pair up the new doctor with the most experienced one we have. And that's what I had. And that's probably what I would offer to whoever is joining me. Because starting off fresh, you need all the support that you can get. So we'll give you that. We'll give you the support that you need clinically and on the managing side as well. So I had it. I would assume that we will link the new doctor always to the most experienced assistants. Yeah.
Perfect. Mike, what's your experience with dental assistants and hiring and pairing and making it all work?
Yeah, I mean, where it turns out to be is, I think it's like with anything, like obviously, yes, as a new doctor comes in, to Dr. Gerard's point, they go through 4 to 8 weeks of training. It is paid training, in case anyone's wondering. But during that training process, you're in an office and you're almost like the assistant to the doctor, and then the doctor's the assistant to you. And then you actually kind of get turned, I don't want to say loose, but kind of to do it on your own, with that doctor kind of in the shadow behind you, to make sure you're ready to go back to your practice. That mentor office and that teaching office, we not only look at the doctor, but we do look at the DA staff too, because we want them teaching the right things. We look at the OM and the PSRs that we have there, so the patient service reps and the office managers. We make sure that those are the right kind of people that are going to help you along your journey, and not somebody's going to discourage you from, learning and really understanding the Aspen model. So it's good to have that and know that ahead of time. As a new grad going into your new office, yes, to Doc's point, we're going to put you probably with the most experienced person we got, because they're going to help you the most. But as time goes on, you start to maybe click with another DA, and maybe you do really good procedures with this one, or this one's really good at RCTs. You start to kind of develop those relationships and understand who to lean on when. And so we also can get flexible with that as we go. I have an office that I was in today that has 5 DAs and 2 doctors working, and they kind of continuously rotated throughout the day based on the procedures just that were going on. So if it was a surgical, full mouth extraction and deliver case, versus we got to see 6 crown preps and an RCT on another patient. So it just depends on what's going on. But yeah, I mean, the DAs end up being your choice too. You find people you like, even if it's clay you want to mold into a DA, somebody who's just got a really great personality and a good chairside manner. State of Michigan allows us to train from the ground up and then certify through LARA with an X-ray certification. So we're here to help support and make that happen. We have great training programs for the DAs, but again, it kind of turns into a personality match in the office.
Awesome, thank you. So I had 2 questions kind of similar to one another. How satisfying monetary wise is it working with Aspen, Dr. Gerard?
Monitoring in what exactly?
Like financial, do you feel like financially Aspen's a good place?
It's really, really hard to answer this question. Overall, yes. First of all, I'm satisfied. Yeah, way more than satisfied. But it's really hard to compare that to private practice. There's a lot of factors that kind of comes in and out with that decision. But the good thing about Aspen is that they cover you with a base salary, and they add a percentage based on the production. So they leave room for you to work. If you work more, you get more. If you are just the person who gonna stick to the schedule, not being super. That's why I keep saying hungry for work. If you're not that person, you got your base salary. The base salary itself is still good. It kind of fights with a private practice salary, at least to what the offers I got. So Aspen beats all that with their percentage that they add on it as a profit share or as a bonus that you get if you work more. So financially, I cannot complain. It's definitely a good opportunity. Yeah.
Wonderful. Mike, did you want to add anything?
Yeah, I'm financially happy. No,
I get
no,
are you happy too?
yeah, absolutely. I feel very well taken care of. No, and when I look at the doctors, you know, to Dr. Gerard's point, the hungry docs, and I don't just mean the ones I buy lunch for, but the hungry docs that want
That's me
more, that's you too, are the ones who make more. I'll be honest. Like I said, it's the doctors who want to help, you know, who have a full schedule, who a patient walks in and they're in pain and number 14 needs to come out. And instead of saying, schedule them next Tuesday when we've got an opening, that's the doctor that's saying, get them in my chair, we'll figure it out. This patient needs to be taken care of, because that's what I would want if that was my mom. And they look at the business, they look at the patients from a sense of they're our family once they walk through the door. And when we're approaching someone like that, we don't want them walking out in pain. And we'll find a way to make it happen. That's when the team rallies around. And those doctors, those are the doctors that they do well. I've got doctors, MCDs making, 20,000 plus a month, easily, every month. And then I've got associates who, they're making 60 grand a year because they only want to work a couple days a month. But to doctor's point, they just want to come in, work a schedule and be good. So, if you plus it out, I saw the question in there about like salaries and things like that too, for a new grad. I mean, your starting salary can be anywhere based on what you're looking for from a day's perspective, from 110 to 150 grand a year base. And that's really just depending on what you're looking for, the area that you're going to be in and how many days you're working. So.
Going along with that, someone just asked, and I think this is a really good one because we could compare to how private practice models are when it comes to finance and how they pay their doctors. So Dr. Gerard, do you work with other dentists? And if so, is there a competitive nature between the dentists considering the monetary incentive to work more? So are you competing for that root canal that Dr. So-and-so also, would want, or, they treatment planned it? Are you still able to see that patient? How does that work? Are you fighting over that crown, root canal, whatever it might be?
So based on my experience, I didn't have to fight with anybody, luckily, but because I've always been the only MCD in the office. The only doctor that I would have with me is the owner, and usually they're doing surgeries and big procedures. We don't fight for it because everything just goes on the same well at the end. It's not that you get paid per procedure, but I will let Mike answer that question more because he works with more offices with multiple doctors. But based on my experience, I didn't have to go through any of that because I have always had the owner with me in the office.
Yeah, Joyce, this is a great question. This is one we get a lot. Is there a competitive nature? I think yes, but it's not for the patient care. It's just to help each other get better. The way everything works within the Aspen model, and when you work with the recruiters and Ruby, and they go over different profit share models and things like that. That's why our percentages are a little bit different. It's not based on charge out provider. It's based on charge out office. We expect and train and coach and develop our doctors and office managers and hygienists to work as a team. And so I wouldn't want to punish an associate for taking longer with an extraction case and the MCD having to go in and do a quick filling on a patient because they were doing right by that patient, or maybe pulling out some extra teeth because once they got in there, there was more than anticipated. So the goal is it's everything's based off the total production in the practice for the doctors. So it also involves you rallying your hygienists. I always tell doctors, you want those SRP cases, you want those gingivitis cases. That's money you're getting into your total that, I'll be honest, you don't have to work very hard for. You're just verifying the script. And yeah, it's patient care, and that's patients getting healthy. But at the end of the day, too, we're all here to work and get paid for what we're doing. And doctors deserve to get paid for what they're doing. And so, that it's an easy way to, help bolster your total revenue package as a doctor. But that also means that you have the team leaning on you. So when they're out there to coach and help you, the big part of it is truly believing that everybody has the positive intention of growth. And with that, everybody grows together. Rising tides lift all ships. And that's kind of the way we work.
Wonderful. Now, Mike, you mentioned, the SRP cases and, kind of want kind of things. Are you ever the person, or your director? Are you guys dictating what kind of procedures
no.
in the office, or?
Heck no.
Okay.
No. See, I don't know where he's at on your guys' screen, but wherever he is at, the guy in the red shirt with the gray sleeves, that's the guy that sets the treatment plan. I know one thing, and that's business management. I've been doing it almost 20 years, and that is, being a doctor is not my expertise. I will put it right out there. I know that there are other DSOs, there are other offices out there, small groups, large groups, even private practices, where treatment plans are either predetermined or they are set by somebody. The doctors set the treatment plans. Now, that's not to say that two doctors won't disagree or two doctors won't have different ideas. I have a philosophy that if you put 10 doctors in a room, you end up with 12 treatment plans. So at some point, those two doctors just have to get on the same clinical page and have that discussion as professionals. But that's not my spot to step. My spot's to support. So.
Wonderful. Dr. Dar, do you agree?
Yeah.
Just don't tell them about that RCT I diagnosed the other day. I'm just kidding.
I'm the guy with the red shirt and gray sleeves. Yeah.
That's what you agree.
So yeah, I agree with him. At the end of the day, it's your license, and the doctor who sees the patient and charge out the treatment plan is the one who's, let's say, responsible for the treatment plan. And you say SRP, it's an SRP. Yeah. So you diagnose the patient, you diagnose the treatment. So.
Wonderful. So I have two questions that are kind of linked. And one is kind of exciting because we did just do some merging, and we have been doing a lot of CEs regarding this. So any possibility of incorporating implants in your practice?
Who are you asking?
I guess Mike first, since you know a little bit more of the business side of things.
Yeah, let him go.
Yeah. Doc's always good.
Age before beauty. Age before beauty. Go.
Oh yeah. All right. I hate you. All right. So yes, obviously, for those of you who have paid attention in the media, we did just acquire Clear Choice, but that's not to say that we're merging our offices. We're currently located in different areas. There's some crossover, and there may be some merging in those areas, but that's to be yet determined. But we do offer implants. I oversee the Traverse City office and the Gaylord office in Michigan, and both offices do implants daily. They did it all on 4 case last week in Traverse City. Our Mount Pleasant office does them. Our Walker office in Grand Rapids does them. And in fact, we're rolling them out across pretty much the entire Aspen Nation at this point, with additional CEs that the doctors got to take. Unfortunately, they're not always at convenient times. but we do make them available and at no charge for those CEs, especially with the Aspen initiatives that we roll out. And then we're also installing CDCTs in each of the offices that we're going forward with doctors like Dr. Gerard that want to, really continue their abilities and grow their abilities for their patients to be able to deliver on more options.
Wonderful. And going along with that, Dr. Jar, have you taken any CEs?
Yeah, and I want to add, I agree with what Mike said. I want to add on top of that when we go to dental school, you always hear about a new thing coming. And you always, for example, when I was in school, I keep hearing about Invisalign treatment, implant is growing, and most of the dental schools are still not super powerful with that as for teaching thoroughly with all these technology coming in, with all these treatment options. So CE courses is of course very important, and we have that offered here. For example, now we do Invisalign. It's been, I think, 2 years for me. I've been doing Invisalign, and now implant that I took two of the, is it four, Mike? I think four.
There's four of them.
Parts, yeah, of the implants. So I'm definitely excited and waiting for my time to come in to actually join the implant market because that's where dentistry is going. So, yep, CE credits are offered at no charge, and usually it's up to the point with all kind of new technology or treatment options that comes in the market.
One of the things that, kind of to echo Doctor a little bit there is we know what's coming down the pike. We want to make sure we're able to offer it. So the one thing we do as a support organization is get ahead of that curve so that we're able to not only offer it to our patients, but offer it to our owners and our doctors for a better price point so that they're able to keep price points low on, different procedures for a patient. So I'll use the Invisalign as an example. Any office that does Invisalign currently has an iTero scanner. So every patient is getting a 3D scan as part of their new patient exam. It helps the doctors diagnose. It helps show the patient and educate the patient, which is what we start with. It gives a visual representation because as much as we've loved x-rays for the past 100 years, I've been here 5 years and still can't read them. But I can look at a 3D model and tell you what's going on and that there's a problem in some spots where doctors showing me. But what it just allows us to stay ahead of the curve. And then also because we were able to get those at such a high volume at a discount price for our owners, it also allows us to minimize how much we have to charge our patients for things like Invisalign. And so we're able to do the same thing. And that's the goal with implants. That's the goal with any program we roll out, is to keep it affordable for the patients. Because end of the day, dentistry isn't expensive, the neglect is. However, helping patients make it back to healthy is the goal. So we want to make sure we can bridge that gap.
Thank you for that. Thank you, both of you. I have that's ready to retire, it looks like. They want to know, what does Aspen offer for retirement plan?
Hey, from a financial standpoint, never too early to start planning. That goes for you too, Ruby.
Oh, I've got my 401k maxed. Oh yeah, my mom's an accountant. She's already got
Perfect.
yeah.
Well, that's exactly what we have to offer. We have a 401 program that you qualify for. I believe it takes 90 days to qualify for all benefits packages. So
with match, there's a 3% or 4.
It varies by area and position.
Oh, okay.
So I'm always a little hesitant to guarantees, but yes, there is some match programs out there.
Wonderful. Doc, are you ready to retire?
No, he's not.
No, not yet.
Not until January 1, Doc. January 1, you can retire.
Oh yeah, it's coming up. Yeah, but I know I've been really lazy on this, but every 6 months I say I want to do the 401k plan, and I never started.
Right.
So Mike,
Next
next
visit, I'll
time you
get you
come in,
registered.
yeah, next time you come in, definitely remind me because you know
I'm
how small my mind
always
is.
here for support, Doc.
Yeah, thanks.
So I know we did talk about the schedule already. So I'm going to skip over that, but a follow-up question to it was, I guess in terms of the schedule or just the, environment, the culture, why Aspen over any other, corporate or any other DSO, dental support organization? Dr. Gerard, why did you choose Aspen over any other DSO?
I've had a couple of interviews with other corporates, but I never worked with other corporates. I had one that it was a corporate for like a Medicaid insurance, and they were mainly doing just the extractions fillings. That's it. So I didn't like um, the job. I didn't see myself like that. I had another offer from another corp, and their wages that they pay were really low. So I had my interview with Aspen and kind of beats both of them on both ends. So I didn't have a lot of experience with other corporates, but just my two interviews that I had, I just didn't see myself, or at least didn't find what I'm looking for in those offers. So kind of joined Aspen, and then everything been like pretty much like what I wanted. So I haven't been looking for more offers. So
Good.
it's been,
I like hearing
yeah,
that.
yeah. So it's been it's been good, but I don't have much more experience with them any more than that.
So, going along with how you mentioned some of the other DSOs that you interviewed with, they, did only certain types of procedures. There's sometimes a mixed message about Aspen and, being so heavy on dentures and extractions and being a dental. Can either of you, Mike first, what can you say to that, that stereotype of Aspen Dental?
Yeah, I think as a doctor, again, you're treatment planning the patient. So if there's a lot of dentures you're doing, you're just seeing a lot of patients you feel that need dentures. I have I have offices that do, Dr. Gerard, your office does anywhere between 70 and 85 dentures a month. But then I have
Yep.
other offices who are in the same revenue stream levels that are doing 12. And frankly, it just depends on what that area is needing. That demographic may be different. The affluency of the population might be different. The background, the time we've been there, the maturity of the office may be different. So it really just depends. But again, I always bring it back to, I love when a doctor will tell me, I'm just doing a lot of forced surface fillings. And they look at me like I'm supposed to change it. And I'm like, okay, doc, you prescribed them. What do you want me to do about it? It just really comes back to it. It's like, we don't have the clinical control. Now, I'll tell you the failure rate of a forced surface filling compared to a crown, but I'm not going to tell you to change your treatment plan. If you don't like the work you're doing, it's the treatment plans you're giving, is what I tell a lot of the docs. But we do a lot of dentures. I won't lie. A bulk of our practices, we do see a lot of dentures. And that is out there because we even have private practice doctors who can't turn around a denture like we can. Dr. Gerard's lab can have you from new patient exam to extract and deliver in 3 days. And so that's huge for our patients who are not only in a time crunch, but are also, in pain, or they have infection, and from a health perspective need to get those teeth taken out. So we do have I say we have the denture system on lock because we have our in-house denture labs and 1 to 2 techs in every lab. And Dr. Gerard has the premier tech. So he's got the luck of the draw on that one. But it's one of those things that we've really narrowed that market, because that was an area that it just didn't have a lot of support, and a lot of private practices are still sending out to labs for every step, when we can do an impression and a bite in the same day and do extract and deliver the next. So yeah, I would just say it's what you treatment plan. It's not who we are, it's what you treatment plan.
Anything you'd like to add, Dr. Gerard?
Yeah, so it's mainly, you prescribe the treatment plan, like Mike said. So basically, they come in, you can treatment plan bridges. I do everything. If I have some time and the patient is really in pain, and there's no other offices around me that can do molar endo, I do molar endo sometimes, even though I hate it, more than I hate skydiving, but I still do it if I have to. So I have patients, family members, they come in just for hygiene, cleanings, every 6 months. We have patients that we do a lot of crowns and bridges. Some of you like that. We do a lot of cosmetic dentistry too. We do veneers, even I do composite veneers, chair side. And we do dentures. And I understand where probably the question is coming from, or the concern is coming from, because I was a student less than 5 years ago. So I've had Aspen representatives and private practice representatives come into my school and talk to us about their opportunities. And you always hear that vibe. I hate to say it, but you always hear that vibe that Aspen Dental only does dentures. And I heard that personally. So, but it didn't stop me from finding that out myself. So you can always discover things yourself. If you want to listen to everything that people say, life would be hard. And you can, like he said, you can turn your office into an Invisalign master. Also, it depends on the demographic, of course, but you can treatment plan. If you can talk the patient into saving the teeth and it's worth it, talk them into saving it. But with dentures, because it's not, I know I took a little long this answer on this question, but it's actually a good question, because with dentures, it was my biggest fear coming out of dental school to join Aspen. Like he said, like Mike said, it's almost up to 50% of the patients are denture patients. So you need some denture knowledge, and the experience with dentures come in as you work. The more dentures you do, the better you'll get. So don't let the dentures kind of get you a little scared. I know that my professor in school used to say that the happiest denture patient is no patient. But you can get him this close to being super happy. I've had some of them even request their teeth come out and put the denture in like 1 week before a wedding or something, because they hate their teeth, and that's the power of turning the denture into 2 days if they need a week before the wedding or something. So yeah, it's definitely a good experience. And I tell you this, I started with Aspen knowing only book-wise about dentures, but don't really know much with my clinical experience. But now I know a lot of things about dentures and a lot of tricks into adjusting dentures to make them from garbage in the patient's eyes into actually something that is life-changing. So it's actually a good opportunity to learn and help a lot of people that actually needs it. So
does the lab, the in-house lab, the tech, do they support you? Do they ever come out? How does that work exactly with all this stuff? And
most of the times the labs are not, the lab techs are not to work with patients and do things chairside. But in some occasions they can. I don't know if it's by law or not, but the thing is that even if the lab tech did not come in to the op, even if he's in his lab, if you just tell them what's the problem, their experience, they know what's going on. So they help a lot. And I would not, I would actually admit it that I learned a lot from my lab tech on dentures because he was experienced with dentures. He worked with dentures for 20 years. So, and now I have the best tech in Michigan, like Mike said. She helps a lot as well. Like it's a big plus. So, yeah, don't let the dentures scare you because you'll be that quick.
Yeah. I mean, most doctors we talk to graduating, they've worked on anywhere from 5 to 15 dentures in their career so far. We usually can polish that out in a week.
Yeah.
So you get over it pretty quick. So
yeah.
So great. That's awesome. How many, I just had someone ask again about patients. I think people are really scared about how many patients they're going to see. So how many patients do you see on average daily, not including hygiene patients? And I guess, could you compare from when you were an associate to now as an MCD, how many patients daily, not including hygiene?
So we give them numbers.
yeah, I can give
count.
some. Yeah, I mean, I can give some kind of generals because Doc's got a very unique situation with the fact he started as an MCD too. So most of the offices that have an associate doctor, the associate doctor is seeing anywhere from usually 6 to 12 patients in their chair. And the reason why I say that's kind of it's a long span there is because not only do we not determine what the treatment is, we don't determine how long you need. Dr. A may be different than Dr. B, and frankly, even our associates, you might come out of school super, amazing at simple extractions, but maybe it takes this doctor a little bit longer. You might be really good at RCT because you did an extra course study on it, and the MCD might actually be slower at a root canal. So it depends. You tell us what you need from a time perspective. So it does vary from time to time. Our average associate, like I said, sees anywhere from 6 to 12 patients in their chair. That doesn't mean that they won't wander out of their chair and see a new patient here or there, and that kind of includes that number, or maybe an overflow patient where it's a denture step that they're helping the MCD knock out. For the MCDs, they see on average total existing patients for a day somewhere between the area of usually 23 and 28. So it just depends on the procedure times. If you've got 6 crown preps on one patient and that's your morning, well, your column A is pretty much locked up for the day with one patient, but you'll probably step out a few times to go to see new patients.
Yeah.
Thank you. So we're kind of not short on time, but it's almost 9. So I'm going to just ask one more question, and or maybe 2.
Speed round. Let's go.
Yeah, I know. Okay, these are gonna be quick. Ready, Dr. Jar? Dr. Jar, do you feel like you've grown as a dentist since joining Aspen?
A lot, yes.
Yeah.
A lot, yeah. Because not only in dentures, but extractions. You probably don't get to do a lot of extractions in dental school, and you learn different techniques, different tricks. I don't think you do a full mouth in extraction in dental school. Here, you do them maybe 3 times a week or so. But yeah, in everything, and that's the opportunity that I was talking about, is growing and improving. There's always room for improvement. So even now, I'm always looking for ways to improve myself. Never be satisfied with what I got. I'm always looking for more, and there's always room for more. So yeah, definitely, yeah, a lot of improvement. Yeah.
Wonderful. This can be for the both of you. What challenges do you face on a day-to-day basis, and how do you overcome it? Mike.
Oh man, 3 minutes was first. What challenges do I face? I mean, I would say my challenges are probably very much different than what the doctors face. My goal is to try to keep the challenges off the doctor's plate. You know, at ADMI, our philosophy is we support the people who take, you know, we take care of the people who take care of our patients. And so I think, you know, I would say probably the most common struggle right now, especially with just the social environment we're in and the current climate we're in with the pandemic, is staffing. DAs, there's a nationwide shortage on skilled DA labor. And that's probably our number one struggle day in, day out. We've had to take to, you know, what I spoke to earlier, you know, molding clay that we find because frankly, there's just not a lot of trained DAs out there. Even the schools where certifications are usually earned, the enrollment's down 200, 300%. So we've got to, you know, do what we can to make sure our doctors are supported. And sometimes it's helping get them over the hump on that training, but understanding that you're training somebody from the ground up and they're not going to bring in any bad habits either. So that way I would say from a doctor's perspective, that's the number one thing we face. We haven't faced anything with PPE. We haven't faced anything with supplies. We've been able to get anything we need since we've reopened back up. And in fact, a lot of our offices never even, well, 3 of my 6 never even shut down just due to need. So.
Wow, that's great to hear. Dr. Gerard, your
you say I'm your daily struggle, we're done.
What's your day-to-day challenge and how do you overcome it?
Okay. Yeah, my answer is a little different than Mike in this because I'm more into clinical. My struggle was managing the schedule because I saw a lot of questions about schedule. You know, managing pretty much 3 to 4 people in 1 hour. Not only that, but then on the next hour, you have another 3 to 4 people. So now my struggle is I want to get 6 or 7 people every hour. But the schedule is falling apart with Corona regulations. So the struggle is now for me is to keep people in, keep the flow going, and keep the business running pretty much. With this, like the shortage of the DA, for example. But for example, we're still trying to grow, and that's our challenge for the next couple of months. So to find maybe an associate dentist and grow more and try to get more people in. So how do we overcome that is by, you know, sticking to the plan and keep confirming people to come in and try to get people in and out faster and deliver the best care possible. So
Thank you for that. So we are kind of nearing the end of this. Is there any closing remarks that either of you want to give? If not, we'll conclude this evening. Either one.
Doc, I'll let you go first.
Yeah, I would just say that I had a lot of questions when I was about to make a big decision. This is a big decision to make when you are about to join a new career, different than dental school. So feel free. You can have my email from Ruby. Is it? Yeah. And or send her the question, any questions you have, and she'll forward that to me. I'm more than happy to answer any questions you have or any concern that you need to know about. So yeah, don't feel hesitated. Let me know.
Thank you.
Yeah, and I would say, you know, to echo Doc, if you have questions, Ruby, throw my email out there. Yeah, I've been with Aspen just over 5 years in different support capacities, and as I continue to grow, even as we go, I came from 15 years in food service and came here. That was scary, but it all came down to a couple things, and that was the people, and then for what I used to call customers, but now we call patients, And it was the experience we could give them. And so the goal here is that we treat every patient like our mom, and as that's based on the premise you like your mother. But you're able to take care of the patient, work with your team to do so, and just continue to grow yourself. And if that's what you're looking for, and you're looking for multiple paths for growth, for opportunity, relocation, whatever you're looking for, there's a path here. If you're a doctor that is looking for the things that we talked about, the doctors that are successful here too.
Perfect. Thank you guys so much for, joining me on this Ask Me Anything session and answering all of those questions. You guys answered so many, and they were really well, answered, obviously. But we do also allow for shadowing opportunities. Do you know, are either any of your offices, Mike or, Dr. Gerard, if you guys are open to it? I'm sure students will also be wondering if that's a possibility.
Yes. Yep. So we offer shadowing in almost every Aspen office in the area. I can actually speak for a few different owners on this. So both Dr. Lucas Perry, depending how far north you want to go, Dr. T up in Gaylord and Traverse City. So if any of you northerners in downstate or from Morgantown are coming up to northern Michigan, Dr. Gill in the Lansing area does shadows. So even Dr. Saman does them in Royal Oak. So absolutely work with us. Only thing we'd ask is that right now, obviously, just with everything going on, we may have some screening questions that we have for you, just because you are also working with patients on a day-to-day basis potentially, and or have traveled as of recently, maybe not to Miami like Ruby, but maybe somewhere less fun. So just if it's in a hot spot, we've just got to do everything we can not to just protect our teams, but protect our patients as well.
Perfect. Thank you so much again, both of you. And thank you to everyone that joined. This will be posted on YouTube, so you can review this at any time, and we'll all be in touch soon. And thank you. Have a good evening, everyone.
Yep. Have a good one.
Bye.
Yeah.